when patients go into respiratory failure, like from COVID-19, they generally get intubated. If they don't wean from ventilator use within a week or two, then they usually get trached. Okay. So now, when they get trached, or for that matter, when they're intubated, they're at very high risk of infection because there's always very bad, what we call pathogenic bacteria on these foreign bodies, these tubes, okay? And because the tubes do not have a blood supply, you cannot get antibiotics to these bacteria. So, and we also know that anybody with the tracheostomy tube has as much pathogenic bacteria in the lungs as anyone with acute pneumonia. Whether they have pneumonia or not, they have as much bad bacteria in their lungs as people with acute pneumonia. So the whole thing is you want to minimize how much time your patients have invasive airway tubes. Now, my background is with people who are too weak to breathe, spinal cord injured, morbidly obese people who are just too weak to breathe, neuromuscular disease patients who are too weak to breathe. And what I learned was that you never need to put an invasive tube through somebody's neck because somebody is too weak to breathe. If so, then how come my spinal muscular atrophy patients are 25 years old now with zero vital capacity? They cannot move any air at all. In fact, they have absolutely no muscle use at all, except for their eyes. They literally cannot grimace, they cannot move their tongue, millimeter, nothing, absolutely nothing. But they're not dead, and they don't have trach tubes, okay? So I asked myself, what should the criteria be in the rehabilitation of COVID-19 patients to remove the trach tubes? Now, there was recently an article on 1,890 patients with COVID-19 who got trached because of COVID-19. And many of the patients died, and many of the patients never got their trach tubes out. And nobody seems to have any idea of when it's safe to do that. So I recently wrote up some information, and I actually have a paper that's about to be approved on proposed criteria for decannulating, removing the trach tubes of people with COVID-19. And basically what I created was criteria saying that either you have to be strong enough to breathe with diseased lungs or healthy lungs and too weak to breathe, but we can take your trach tube out. But we cannot take your trach tube out if you are still too weak to breathe and have diseased lungs, okay? So that's sort of the bottom line of what I want to present. And many of my patients, well, I have patients with neuromuscular disease who got COVID-19, but most of them are relatively young, so they didn't become symptomatic. But that's sort of the gist of it.